So we're here to educate all of you on dental hygiene. We're in the dental hygiene program at Madison College in Madison, and we're going to graduate this coming May. We are the people that when you go to the dentist, we clean your teeth, we take x-rays, we put sealants on your teeth. And then a dentist, does anybody know what a dentist is?
Yep.
Willie, hit your hand up first.
Yeah.
The only name I know.
What dentists are is because like clean your teeth if you have some like rotten teeth. Cause I remember. Right, they give you laughing gas too. I was at a dentist before. I was at a dentist before.
So a dentist is the person who fixes cavities and finds cavities, and they also have a helper which is called a dental assistant. So we're going to go over some vocabulary just so you guys kind of know before we go into different groups.
Okay. Sure. Does everyone know what a toothbrush is?
Yeah.
I do not know what a toothbrush is. Okay. Just a little farther. Does anyone know how many times you're supposed to brush your teeth a day? Yeah.
2.
Yes. Do you know how long you're supposed to brush your teeth?
Like 2 minutes.
Yes. Good job. Since you're so smart. How often are you supposed to change your toothbrush?
3 months.
Yes. Good job.
We have smart kids here.
Okay. The next one. Floss. Does everyone? What is floss?
It's
Raise your hand.
Get in between your teeth, get all the fluid out.
Yes. Does it have like a brush or is it just like long and string-like?
Longer.
Right.
Yeah.
Yeah.
Stuff that.
Oh, on the stick?
Does anybody else know what you remove with floss between your teeth? You can just tell me.
The gunk that's in between your teeth.
What is gunk?
Yeah.
Like corn, like how don't remove that.
What are, out of the words on the board up there, do you know which one is like the gunk?
Plaque.
Yes.
Very good. So plaque is a stuff if you take your fingernail and scratch your teeth. If you get any stuff on your finger, that's plaque. So that forms after every 2 minutes after you brush your teeth. It starts forming already.
Yeah.
I don't know this.
And then enamel is the white stuff on your teeth.
That's what keeps your teeth hard.
It's super hard. It's harder than your bones. So that's what keeps your teeth strong.
Just got braces.
Sandy!
Oh.
Just got braces.
Point at her.
I'm getting first.
Yeah.
I know we asked it on your little survey that you guys all took, but I'm going to
That's what they used to fill it.
You're close. You're kind of close. On the right
The
track.
stuff that when you go to the dentist and they like on your teeth with a brush.
Kind of. You might be thinking of fluoride.
Yeah.
They kind of brush that on your
Fluoride
teeth. Yeah.
doesn't taste good.
Like, yeah,
No,
it's kinda- But sealant is when your teeth, your like adult teeth start coming in. They have some really deep grooves, and you'll see some pictures. So they have some deep grooves in there, and we want to protect them from getting cavities because those deep grooves, like the plaque and sugary foods, can get stuck in there really easily. And so your dentist will, or your hygienist, we can put sealant on too. They put it in this.
in the grooves so
Yep,
that
in the
it's
grooves.
more of a flatter surface so that the stuff doesn't get stuck down in there.
Actually,
You all
I
probably can
know
feel.
what that is. When you get cavities, I had 2 of them before.
Yeah.
Yep, they got put in.
Yep, so a sealant is what we do before you get a cavity. So we're trying to help you not get cavities so you don't have to.
So the question is it better to end a meal with a chocolate chip cookie rather than a protein like cheese?
I eat cheese. I can't
So-
have cheese. I have cheese.
So a lot of you guys put false, so it's better to eat cheese at the end, which is true. That's
I think
correct.
also, yes.
Because, and this gets a little
I
complicated,
love
but
cheese.
there's pH in your mouth. And I don't know if you guys know about that yet, but there's
Acid.
acid side
I
and there's
know.
more of a base side, so the better things for your mouth. So when you eat protein, it's more base-like, so your mouth doesn't form cavities as quickly. Because when you eat acid and acidic things, cavities form quicker.
We'll have an activity
Kinda
later
like
that will kind of
Pop
show you what
Rocks.
that means.
Pop rocks and glued acid, I think.
Yeah.
Because how they pop around.
Well, it's the sugar that's in
Yeah,
those.
that too.
But we have an activity that you'll be able to see what acid does to your teeth. And so that's why you want to stay more with the
Yeah, more with like cheese because it's a base like cake.
Okay, we're gonna keep going so that we get through all this stuff.
So the next one was, is it normal for your gums to bleed when you brush your teeth?
No.
Right. So when your gums bleed, you have a small infection in your mouth. So that's why it's really important to brush every day and floss because it's getting all the bacteria out of there. So if they do bleed, you just gotta make sure you keep brushing and keep flossing so that you get all the bacteria out. Because most people think when it starts bleeding, you should stop because it's hurting, but you really want to still clean it all out of there.
I remember a question from the server. Is it good to drink soda all day long? No. That is not good.
Right.
You know why?
That's got lots of sugar. That's no different than Pop Rocks, really. Just not.
I definitely have a lot of sugar.
Sure. So when we drink when we drink soda all day, it has a lot of sugar, like you said. So every time we're drinking soda, it like bathes all of our teeth and our mouth with the sugar, and that kind of gets it to the acid side again, like we talked about, the high pH stuff, and that's what causes cavities. So if we're sipping on it all day, our mouth is always on the acid side. Where if we just drink it, it's okay to drink soda, like it's not bad. But if you drink it, you want to drink like the whole can at one time instead of sipping on it. Because then after you finish the can, it gives your mouth time to go back to like its normal, basic side. So it's not.
So you just want to gulp it all down then?
You don't have, you don't have to gulp it, but you just don't want to sip on it all day. Right.
And it's better to drink it with a straw.
Yeah, so if you drink it with a straw, then it kind of avoids all of your teeth, and it just goes down the tubes.
Sure that you get all surfaces of your teeth. So I want you to start, when you start brushing your teeth tonight, remember where you started. Right, in the left, top, bottom. Does it matter? No, but it forms a good habit. So if you start on the upper right, all pay attention? So I want you to make sure you brush outside, the tops of the teeth, your biting surface, and the inside. As well, because you're going to use 3 different areas of each tooth you're going to brush, and you got to brush all of them. So you brush, go ahead. I'll brush for 2 minutes, okay? And we're going to teach you how to floss.
And
How much sugar?
So it might be easier for you guys if you take a piece of floss.
I think you should really messed up.
It doesn't matter what his name is.
Really messed up teeth.
You're going to tie it in a knot, okay? So you got a circle. So it's easier for you guys to hold on to. So you want to make sure you go in between the teeth and you make a C shape. So you're going to take your pointers and wrap it around the teeth. These are broken teeth. So you're going to wrap it around so you get all the germs out on each side of the tooth. So you're going to wrap it this way and this way in between every tooth. That gets it all out. If you don't use floss, you're missing 40% of your mouth completely.
Oh my god, I never used
40%.
I never flossed. I barely flossed.
So,
I don't
if you don't floss at all, I
have floss.
okay, well you'll have some today. So I challenge you to floss at least once a week, and then try twice a week.
No. If they're
Because the day you want to do it 10 weeks later.
Or here. You see how it's under my gum?
How did you get under? Is someone hiding some candy?
Yeah, so let me tell this way, and I have gloves so I can show you.
Aha, look at.
Okay, so think about how you're angling your toothbrush. Make sure you get your gums.
Over here with the cup. And then we can come. Never mind, who has number 2? Okay, and what does that go with? Good job. Okay, who has bag number 3? Okay, what'd you match it with? So, bag number 3 actually goes with the Gatorade.
Oh, that's not actually a lot of sugar.
Okay, what about number 4? What do you have that paired with? Skittles? That's actually the sweetest thing. What about number 5? The Skittles? Good job. So you got 2 right. Okay, what about number 6? 6 is what the chocolate does now?
Yeah.
So that actually goes with the Capri Sun.
Whoa! Oh, I remember 7 on. What happens when you do all your teeth?
Yeah, or you go in the wall.
I did. The Mountain Dew's got that big cake.
What about number 7? There we go. 7's the chocolate milk fountain. Number 8. You do is actually, okay, it goes with Coca-Cola. So number 9 goes with the small can of Mountain Dew, and 10 goes with the big can.
How many people are winning? Who's winning? On the
This is your plaque that you have on your teeth. That's sticky stuff that we want to get rid of with your toothbrush. But when we eat food, we get some sugar in our teeth, right? Food that we have, like we just looked, the soda has a lot of sugar. So that's kind of like this. Who wants to put some of that?
Me.
Okay, maybe we'll put a little bit, you can put a little bit of red. You can put a little bit of green. You guys can both put a little bit of black. Just a little bit. Nice. So what are some foods that you guys like to eat? What are your favorite foods? What is your favorite food?
Hey, that looks cool. Actually, avocado.
Ooh, that's a good
And
food.
squash.
Wow, you like some healthy food. That's really good. What beautiful teeth we have. So this is the sugar that we get from the food that we're eating. And when we don't remove it with our toothbrush and we don't brush our teeth, this stays on and it eats away at our tooth, at our enamel, like we talked about before. The sugar is acid, like Caitlin mentioned. It is more an acidic environment in our tooth, and we kind of want a basic, which would be like cheese and protein and stuff like that. But when we don't brush the sugar away from our teeth, it wears away at our enamel in our tooth, and it makes our teeth kind of burn. Here. It really eats away at our tooth. Do you see that?
Is it actually acid?
Yeah. So that is what's going to happen to your teeth when we don't brush and remove that plaque and the sugar from our food. Isn't that cool? So this kind of shows you what it does to what soda does to your teeth. Sure. Is it soft?
It's like hard.
Okay, be careful with that one. So this one, it kind of stains your teeth. Doesn't it stain? It stains the egg brown. This egg, that is one that got soaked in fluoride. This egg is your tooth. It was soaked in that fluoride, and these ones were not. We're not going to pick this up, but you can just touch it with your finger. Is it a little squishy? It's kind of, you see that it's kind of breaking. It's cracked a little bit.
I know it is because I've done that.
Yeah.
Project.
That was soaked, and it did not have fluoride on it. Yeah, that's what it looks like when your teeth are coming up. So how many of you...
Oh yeah, my cap is gonna
Yeah, so your tooth is growing up there. It's gonna come up. You might kind of pull up.